Hello, everyone. Sarah Muirhead, Managing Director and Editor at National Hog Farmer. Welcome to this National Hog Farmer Fast Chat. Today, we're talking with Dr. Jessica Risser, veterinarian and swine technical consultant at Elanco Animal Health. Welcome, Jessica. Thank you for joining us here today.
Thanks for having me.
So our topic for today is that of why mode of action matters. So Jessica, let's start with the basics. Mode of action. Walk us through how different antibiotics work on and around the cell.
Yeah, so veterinarians choose antibiotics for a lot of the reasons that is described by their chemical structure and how they move around in the treated animal's body, like the speed at which they may move and reach maximum concentration, but also the tissues at which they go to and which they concentrate in, so that we're getting the right antibiotics to the site of disease. And lastly, the mode of action, right? So how they kill bacteria or inhibit bacterial growth is really important to the selection of antibiotics. So just using three antibiotic classes as an example, and we're using swine respiratory disease today as an example too. Three antibiotic classes that are important to swine respiratory disease are beta-lactams, macrolides, and fluoroquinolones. So beta-lactams will work on the cell wall and inhibit cell wall synthesis. So thinking about then macrolides, they go inside the bacterial wall or inside the bacteria itself to the cytoplasm and work on ribosome 50 to inhibit protein synthesis. And then fluoroquinolones, they go a step further inside the bacteria nucleus, and they're going to block enzymes that are important for DNA and RNA replication. So you can see the antibiotics not only move differently within the treated animal, but they're going to work differently on different areas of the bacteria itself.
So Elanco recently brought a new innovation to the market. How does that work? And talk to us about that.
Yeah, so Predilex was approved earlier this year by the FDA. It's the first injectable approved in some time for swine respiratory disease, for treatment of swine respiratory disease. It's a predofloxacin is the active ingredient, which inhibits and prevents DNA replication, and it's a third generation fluoroquinolone. So typically fluoroquinolones, as I mentioned previously, act within the cell nucleus to prevent DNA replication of the bacteria. That DNA replication process usually involves three enzymes. I'll just walk through that real quick here. It usually starts with DNA gyrase, uncleaving and unfolding the DNA, then topoisomerase 4, coming along and separating the two strands of DNA, and lastly, DNA polymerase coming along and completing the replication. And once there's two sets of DNA, then the bacteria can divide into and reproduce itself. What fluoroquinolones come along, and typically other fluoroquinolones would bind to DNA gyrase, which is an important enzyme in gram-negative bacteria. And then topoisomerase 4 is less likely to be bound by other fluoroquinolones, and it's more important in gram-positive bacteria. What's unique about predofloxacin and Predilex is that it binds to both enzymes simultaneously. So it's effectively killing the bacteria quicker and disrupting bacterial replication faster by simultaneously binding both those enzymes.
How does it fit in with your additional SRD antibiotic options?
Yeah, Predilex comes to a really broad portfolio of antibiotics and vaccines that we have at Elanco. It comes in as a different antibiotic, though, because of its mode of action. It allows for more bactericidal, the killing of the bacteria, and then it's concentration dependent, which it's going to reach a very high concentration very quickly. In the serum, it's at a high concentration within 45 minutes. That's going to be different than another injectable in our portfolio, Increxxa, which is a erythromycin, which is bacteriostatic, which inhibits bacteria but not necessarily killing them. And then it's time dependent. So it stays at concentrations above the minimum inhibitory concentration, which is what level is needed to inhibit bacterial growth for a longer period through the dosing interval. And what that really all means is we're bactericidal, killing bacteria, and we're higher concentrations quickly, but also quickly out. So there's a 2-day withdrawal with Predilex versus other injectables would have a longer withdrawal time. Also in our portfolio, we have other antibiotics that may control bacterial diseases, that are contributed to swine respiratory diseases, that are feed additives or water additives. So we're really offering a pretty broad spectrum, a lot of opportunities within our toolbox for veterinarians and producers to address swine respiratory disease in their barns.
What are some additional factors you need to consider to ensure judicious antibiotic use?
Yeah, this is a great question, and maybe my favorite question you've asked so far. So judicious antibiotic use is really important to me, and I really think it comes down to how we can prevent disease and just ensure that the antibiotics are effective for years to come, right? We're always thinking about, we want to minimize the risk of developing antibiotic resistance. So it's really important to use antibiotics how they're supposed to be used. So the first thing I really encourage producers to do is to seek management practices that prevent disease. You know, we talk a lot in the industry about biosecurity, but really the top three things that's important to a pig is water, fresh air, and feed. They want really good quality water and lots of water, and they want fresh air and the right amount of feed and a good quality feed. And those three things are really important. Other preventative health practices could be vaccination programs to help prevent disease or mitigate some of that disease. Another really important thing, and Predilex serves in this purpose, is individual pig care. Identifying pigs early when they're sick and individually treating them can help them recover a lot faster. And then if there are getting to be a high prevalence of those pigs that you're individually treating, making sure that your veterinarian is aware of that so that maybe they can come up with some other treatment options, maybe through the water or the feed, to help reduce and control disease further in the herd. And then lastly is make sure you follow your veterinarian's instructions, right? Veterinarians use a lot of science and data diagnostics to help select the most appropriate antibiotic for the herd and for the disease that they're addressing. And there's a lot of science that goes into the dose that's required and the number of treatments that are required, and and the duration of that administration. So all that information is really important to follow, and those instructions from the veterinarian.
That's all we have time for today. Great tips, great insight. Thank you for joining us, Dr. Jessica Risser of Elanco. For National Hog Farmer Fast Chat, I'm Sarah Muirhead.